crossing 2,000 new daily cases for the first time. The pandemic here shows no signs of slowing down. The Health Ministry reporting 2,236 new infections as at yesterday, September the 28th. The latest figure includes 1,711 cases in the community and 515 among dormitory residents. The remaining 10 are imported cases. Among the local cases are 483 people who are 60 years old and above. Also, as of yesterday, 1,325 cases were warded in hospital, including 209 on oxygen supplementation. Another 30 were in critical condition in ICU. Professor Dale Fisher is here to discuss the current situation. He's a senior consultant at NUH's Division of Infectious Diseases. Welcome back to the show, Prof. Singapore surpassing the 2,000 mark for the first time, even as we have one of the highest vaccination rates in the world. Can you share your take, vis-a-vis the current measures meant to bring down the case numbers?
Thanks, Olivia. These are numbers that were always expected, where we have to live with the virus, so we have to let it in. And we know the vaccine is not very good at stopping transmission. We know the vaccine is good at stopping severe disease. So as I've said on your show and others several times, the numbers don't matter nearly as much as the number in hospital, because that's the one putting the threat on our health system. And in fact, while those numbers have gone up a lot, obviously, there's still a lot of people that are in hospital that don't need to be there. We used to keep people in hospital for isolation purposes because we were trying to really contain it. But now that the strategy has evolved that we're not trying to contain it, we still have to message a little bit harder and be more encouraging that those people that aren't at risk now don't need to be kept in hospital for isolation, and they can go and do home recovery.
Right. So on that note, 30 people so far have died from COVID-19 this month, and a third of them were fully vaccinated. Well, that's worrying, Prof. What's your perspective on that?
Well, it's obviously sad when people die. I certainly wouldn't want to diminish that, but unfortunately that's what this virus does, and that's why we've been so aggressive at containing it. But we really have to accept the fact that we have to come out of the pandemic. We can't keep containing it forever. That's not sustainable. There's, you can look anywhere, whether it's schools or social interactions, weddings, religious gatherings, people's businesses and livelihoods, family get-togethers, and indeed other health issues, whether it's about physical fitness or being able to access medical checkups or have your cancer screenings or mental health. There is just so much of a price for all those restrictions that we have to come out of them. And now that we've got a vaccine, we can. Now, unfortunately, we know the vaccine's not 100% effective, but on your figures, you're saying a third of the 30 people in the last month that died were vaccinated. You've got to remember there's 10 times as many people vaccinated as unvaccinated. So you've got 10 times as many vaccinated and a third as many people dying. So this is like a 30 times protection rate. So that 96, 97% is what we're always working on, is the effectiveness of the vaccine in preventing death. Unfortunately, it's not 100%.
Yeah, good point. Well, Prof, let's turn a bit more broadly, to border controls. The US has raised its travel advice for Singapore to its second highest level. Would the US's move deter other countries from discussing vaccinated travel lanes or any other arrangements with Singapore? And should Singapore relax border restrictions?
Yeah, it's a good point. I think it makes absolutely no sense for for travel restrictions by and large, let alone US to raise its travel advice. It's you've still got more chance of catching it in the US than you do from catching it from a traveller from Singapore. But in fact, as you know, today we're more than 2,000 cases, but only 10 of those were diagnosed from people returning from overseas. So there's no bang for your buck in this, making people do all this quarantine on return, because it's 10 cases out of 2,000. So if it used to have a very important role when 10 cases in the community would have been very concerning, but now whether the numbers are 2,300 or 2,310, it really is not an issue. So I think border restrictions globally really need to go.